So this is our testing room, and it's probably a really boring looking room to you. But there's a reason this room is boring, because this is a testing room. So we want to get optimal performance out of the individual we're testing. We want to keep it quiet. We want our walls not to have anything on them. As you notice, we don't even have a window, because windows can be distracting. And also, if you look here, we can actually put that this is occupied or available, so we don't get an interruption from somebody walking in the room. We actually have this on most of our rooms, because just a door opening can take your child off task. So this room is set up, if we have a young adult, we have big chairs. If we have a little guy, we have little chairs. We also have over here all of our testing protocols, and you probably have no idea how many tests we have, but we have about a dozen just for occupational therapy alone. Physical therapy and occupational therapy do use some of the same assessments and overlap, but they also have another half dozen of their own. And speech, we're gonna have to show you their cabinet. Theirs is amazing. They have about 15, depending on the thing they're working with. So there's kits in here. Our therapists just pull the kits out. They're put together and very easily accessible, so we're not having to organize a test while your kiddo's here. We have timers out, because many of the things we do in therapy are timed. So we have timers and stopwatches out. We have our testing protocols, our age protocols out here. And these file cabinets hold testing protocols. So when your kiddo comes in here and it's time for them to have a reevaluation, we're just gonna grab their folder out, and it's gonna have their testing protocol from the last time they were tested. We do this because oftentimes, we're on a flexibility model. So if I have a kiddo and their schedule changes and they're now seeing Miss Jenna has access to the full protocol. So this is just for occupational therapy services. And that's the basis of this testing room. It's set up to hold the equipment and to be a calm place for your child.